Hello everyone, this is Instructor Howard, and this week we are discussing the pros and cons of EHR or using an EHR system in our week 5 discussion. So last week I gave you guys a glimpse of what it's like to audit and code using an EHR system and locating the documentation and pretty much what I do on my job. This week I wanted to give you guys another sneak peek at the various systems. Today I'm working in 2 different EHR systems and the pros and cons to them. So what you see on my screen right now is a patient's abstracting where the coder went through the medical record inside of a site for a company, and the way that we were able to access the documentation is through a system known as a virtual private network. And what we do is we pretty much dial into that system by way of the internet, and I'll give you an example in 1 second. Okay, so here we see the various hospitals and their VPN connection settings. So from my computer, currently I am connected to this particular company here, and I can access other companies the same way. And once I'm connected to these particular companies, I'm able to log into their system as an employee or a user and pull documentation needed in order to complete the coding process. And in my case, I'm auditing, so I'm able to review what the coder has already coded, which is the screen that you see behind, well, the screen that you see in front of you, and also the procedures that he abstracted from the chart. So this system that we're looking at is a system that was designed by the company that I work for. There are multiple billing systems, so what we do is we're billing through our system on behalf of this company, and we just enter the information or the codes, and we'll submit it and complete it and send it back to the hospital in order for them to actually process it and send their claims in to the various payers. This screen that you're looking at here is a set of documents that I can view from my previous screen from a document viewer. What the company does is they upload the patient's insurance information, their date of birth, basically their demographics, and any relevant information for this particular visit date and service date. So what we're doing is we're just using the information that's here, and we will enter that information into the various systems. Once I pull the patient demographics from the previous screen that you've seen, I can then log into their virtual private network, which is basically their EMR system, and pull the patient's information. This particular system here is called MedHost, and what I have here are the options to search for patients in various ways, search for the patient's name or the patient's medical record number, their date of birth, or their social security number. Having any portion of this information will pull one or several patients up with the same demographics, and then from there I just have to match the service date, the encounter number or the patient number, and the medical record number. So once I've searched my patient, I can go into various areas of the medical record and pull information for this specific visit. This particular patient started off in the ER and then was admitted to observation. And what I've done is reviewed the ER chart for the assessment, the screening, the pretty much abstracting the diagnosis from the chart. And I can see here that the patient was administered some medications, which is normal saline by way of IV. And that right there is something that I need to abstract, because for this particular company, we are coding for all services rendered in the emergency room, IVs, injections, any codes in the surgical range, and or the evaluation and management service if it was rendered. And in this case, I can see that the patient did receive evaluation and management services in the emergency room by the emergency room provider. So I see 2 administrations. This is my code for my injections, which is located in the CPT manual under the medicine section. And I see that there was some IV fluids given. I can see the start time for each, and I can see the stop time for each. So I know that there's at least 2 IVs that I will need to assure that the coder has coded for this day. So another set of documentation that I'm able to pull is the medication administration record, which is also known as the MAR. And in this particular record, I'm seeing that the patient was, since they were admitted to observation, I'm seeing that there were additional IVs given. And now we're going to get into the pros and cons. So everything that I've done up until this point is a pro for EHR. I have the ability to pull the chart, and in a normal setting, for example in a doctor's office, the chart may be in various locations and it's one paper file. I would probably have to search the doctor's desk, any other area of the clinic. It could be at the front desk. The chart could be with another ancillary provider in the office. And if I wanted to go in and pull some information right quick, it would take me a little while to find that actual paper chart. So that is one of the reasons EHR systems are very efficient for us, because now, regardless if I'm pulling the chart over here, another person could have the chart pulled up on their end that works for me and my company, or that works at the actual hospital. And it does not stop the flow of who can view the chart and who can update information. On my side, I'm only given rights to view certain things because I don't need all of the rights like the nurses and doctors do. So that's one thing that is good with EMR, is the security settings. I don't have to view all of the patient's personal information. I can just view what I need for this day to code. So the negative about using an EMR system is that the documentation may not be as complete and thorough as I need it to be. So I saw in the ER chart that the patient received a couple of IVs, and over here I'm seeing additional medications given, and here's the route. It tells me that the patient was given this medication by mouth. That's not anything that I would need to code, but I do need to code for, or the coder needs to code for the IV administration, the IV drips. The problem is that I have the start time over here that it was administered, but I do not have the stop times. So one of the rules about coding for IVs is that we need the start and stop time, because these are coded by the hour. So if I can't see documentation of a full hour of normal saline or any other IV fluids given, then on my side, I either have to have the coder pin the chart and send it back to the hospital for more documentation, or we just omit the code all together. So in this case, I will have the coder omit these codes because it's not documented. And one of the things is if it's not completely documented, it didn't happen. So in this case, this particular facility will probably be losing out on at least 1 to 3 or 4 other administrations of medication. And that if every chart is like this, then that sums up to a lot of money over time. So that's the con or the downside to an EMR system, because the people who are entering the information in here are not aware of everything that we need to completely and accurately code this chart to assure that they receive the highest possible payment for their services. So as I finish up my audit, you see here where the coders codes, what they've coded for the service or the services for today are entered for observation, or the observation portion. And my coding is pretty much on this side. So what I'm going to have my coder do is to delete all of these codes except 2 IV administrations, because at this point there's not enough documentation to assure that the IVs were administered according to protocol and according to CMS regulations. So here he has located and coded accurately the IVs that he saw given, but I am not seeing full documentation to support that. And this is my compliance software where I'm doing a review of the coders coding and abstracting. And so right now, pretty much the only thing that he can actually code for are 2 services. CPT is not supported per documentation will be the reason why I have had him remove all of these codes. And this is pretty much it. As you can see, everything is pretty much done electronically, online, using various systems. The documentation may be in a different order. It may look differently, but all of the same elements are there. So we definitely need the documentation of the visit, the vitals, any services that were rendered. The nurses usually have a separate chart than the providers and the physician, because the nurses will do the triage and they will, work the patient up, and any services that they give to the patient they will document on their own user account. So what I had to do, and this is something I didn't share with you guys, what I had to do is look at the nurse's chart and the physician's chart to make sure that they pretty much matched, and that I was not missing any relevant information for coding for today. And as I'm going to recap, as we discuss, the pros are that the information is right at our fingertips, easily accessible, can be shared amongst multiple people simultaneously, online, in another state, and in another country. And the cons are that, the documentation sometimes is not entered as thoroughly as it needs to be. And as you can see, this hospital, it pretty much cost them several $100s on this particular patient's visit. All right, thank you for viewing. Leave your comments and feedback below. Have a great day.